Alex, thank you. We know how confusing all this new information is about COVID, but we are here to help you understand the facts. Joining me now to answer all your questions is our medical expert, Dr. David Winter from Baylor Scott White Health. Dr. Winter, good morning. Glad to have you with us.
Good morning to you. Good to be with you.
Thank you. Well, an advisory panel to the CDC has unanimously recommended that Pfizer and Moderna vaccines be recommended over the J&J vaccines. Can you tell us why they did this?
Yeah, it's about blood clots, and let me give you the numbers. So there's been 16.4 million J&J vaccines administered in this country. There have been 55 cases of blood clots. Now, Moderna has given 3 times as many vaccines in this country, and they've had only 5. So there's a big difference there. But now, 55 out of 16.4 million is still very, very rare. And it's important to point out, you can also get blood clots from the COVID infection itself. So not getting a vaccine is not a good idea.
So there's this big push to get more people vaccinated, especially now that we're hearing more and more about the Omicron variant. What is the very latest on that?
Yeah, Omicron is spreading pretty rapidly. Just yesterday, England reported 200,000 new cases of Omicron variant every single day. Now, Omicron, it looks like it's spreading rapidly, but let me point out that the test you do at home, the home kit for COVID, if it's positive, or if you go to the doctor's office or a clinic and get the rapid test or the PCR or NAA test for the virus itself, they don't tell you whether you have Omicron or not. They just say you have a COVID virus. So we're doing extensive studies that take longer to get down to figure where it is, but every time we study more cases, we're finding more and more Omicron. So it clearly is spreading in this country rapidly.
Yeah, last check, we reported Omicron now reported in at least 39 states. How concerned should we be? And does Omicron cause more serious infections? Is it more deadly?
Yeah, Suzanne, it's a little early to say for sure. Early studies said that it looks like it may not be quite as serious as the Delta. However, there have been a number of deaths from Omicron, so we have to take this thing very, very seriously and watch out and be careful. So it's coming, it's going to spread. Best thing we can do is prepare for it in advance, Suzanne.
And of course, there are questions because this is a new variant. Are there new treatments for Omicron? And what should we do if we develop symptoms that might be due to the coronavirus?
Well, there are a couple new pills on the horizon. This is really exciting. Pills that you can take at the first sign of COVID and they will lessen the seriousness of it. Not approved yet, they're around the corner, but for right now, we know what works. These things, these masks still work. Washing your hands frequently, avoiding crowds, those things work, and the vaccines clearly work. Now, with Omicron in particular, they found that there's some waning protection over time. So the current recommendation is that if it's been more than 6 months since your second shot of Pfizer or Moderna, you should get a booster. That'll boost up your immunity and help not only with Omicron, but with the Delta, which is still prominent in this country, though it's losing steam and Omicron's about to win the race in this country. So please take care of yourself. Holidays are coming. We want you and your family to be safe and COVID-free, ideally.